Joe was hospitalized for sudden changes in behavior and episodes of extreme amnesia. He was confused about his recent history, and he believed he was 600 miles from the hospital where he was originally admitted, despite it being the same exact hospital. Jane oftentimes writes letters to people close to her, but when in an altered state, she does not remember writing such letters. All the time, she is told stories about memories that involved her, but she does not remember the memories. What could Joe and Jane's problem be? They suffer from a dissociative disorder, or conditions that involve disruptions or breakdowns in memories, awareness, identity, or perception. There are three main types of dissociative disorder. Dissociative amnesia, in which a person has episodes where they cannot remember important personal information and may experience dissociative fugues or loss of one's identity or the formation of a new identity that may occur with a sudden, unexpected, purposeful travel away from home. Next, dissociative identity disorder, where a person can have two or more distinct personalities. And lastly, depersonalization, disorder, where a person has persistent recurring experiences detached from self, outside observer of own thoughts. Things feel like a dream, and the world is distorted. Symptoms of dissociative disorders include self-harm, drug abuse or alcoholism, depression or anxiety, PTSD, an inability to cope, stress, difficulty with relationships, amnesia or constant loss of memory, and sexual dysfunction. Causes and possible risk factors are childhood trauma, like constant abuse or life-altering events. Dissociative disorders develop as a way to cope with trauma. It happens in childhood because personalities are still forming, and if a child steps outside themselves to cope, it becomes a lifelong coping mechanism. Other causes from a physiological or psychological standpoint include the hippocampus and amygdala are smaller in people with dissociative disorder, and the frontal lobe is usually low functioning with a reduced level of blood flow to these areas. This area is responsible for personality and decision making. Dissociative disorders do not have specific medication to treat it, but a person suffering can take anti-anxiety pills, antidepressants, and antipsychotics. Psychotherapy is also a way of treatment. This helps the person talk about the trauma that may have caused the disorder. Prevention options for disorders include talking to a trusted individual about the trauma, the abusing person causing the abuse and the trauma should seek help, and a child should get help right after a traumatic event. Facts to know. It is estimated that 2% of people suffer from dissociative disorder. 50% of people may experience at least one derealization episode in their lifetime. 70% of people with dissociative disorder have attempted suicide. 1.8% of people have dissociative disorder. It is found that in 3 to 6 women in every 1,000 suffer from a dissociative disorder. It is less prevalent in men. 1.8 to 2.8% of people have depersonalization or derealization disorder. Myths versus facts. Myth. People with dissociative disorder have multiple personalities. Fact. It is really more like more than one state of consciousness, hence why the name changed from multiple personality disorder to dissociative identity disorder. Myth, it is rare. Fact, the prevalence rates are the same as major depressive disorder, OCD, and it is more common than autism and schizophrenia. Myth, dissociative disorder is obvious. Fact, it may be seen as a lapse of memory, and people in dissociative states function just fine. Myth. Dissociative disorder is easy to diagnose. Fact. Dissociative disorder is not easy to diagnose because symptoms mimic other symptoms of other disorders. The end. Thanks for watching.